As we age, subtle changes in our bodies can sometimes go unnoticed. Many people assume that death in old age happens suddenly, but the truth is, the body often gives quiet signals months, sometimes even a year before, that the end is near. These signs are easy to overlook, especially when they seem small or natural, like a slight change in appetite or a little more fatigue than usual. But when we look back, we often realize the clues were there all along. In this video, we'll explore 5 key signs that often appear in the year leading up to the final stage of life. Recognizing these early warning signs is not about fearing the inevitable, but about preparing emotionally and practically for what's ahead. By understanding these changes, you'll be able to offer better care, cherish the meaningful moments you have left, and make sure your loved one's final days are filled with comfort and dignity. Stay with us as we share these important signs. They could make all the difference in how you approach the precious time you have left with those you love. 1. Unexplained weight loss, a key sign that can't be ignored. As we get older, it's common for our bodies to change. Some of these changes are normal, like slowing down a bit or feeling a little more tired than usual. However, there's one sign that can often go unnoticed, but should never be overlooked: significant, unintentional weight loss. At first, it may seem subtle. Perhaps your belt feels a little looser, or your clothes aren't fitting quite right. But when the weight loss continues without trying, it's more than just a sign of aging. It's a signal from the body that something deeper might be going on. Many families dismiss weight loss as just a part of growing older, but this can be a serious mistake. Unexplained weight loss in seniors is often a clear warning that the body is no longer absorbing nutrients properly. As we age, our muscle mass naturally decreases, but when this happens too quickly, it's usually a sign that something is wrong. This could be because the body isn't digesting food as effectively as it once did, or perhaps it's no longer able to process protein correctly, leading to muscle wasting. This not only weakens the body physically, making it harder to move and perform daily tasks, but it also lowers the immune system, leaving the body vulnerable to infections. There are several reasons why weight loss might occur in the final stages of life, and recognizing them early can help you care for your loved one with more compassion and understanding. First, appetite changes are common. As the body begins to wind down, many elderly individuals simply lose their desire to eat. Food no longer tastes as good, and meals may feel like a chore rather than a pleasure. It's important to remember that this isn't just about preference, it's a physiological change. The body is signaling that it no longer needs or wants the same amount of food, which leads to decreased energy, less strength, and a gradual decline in overall health. Moreover, chronic health conditions like heart disease, kidney failure, or even cancer can cause weight loss. Often, these conditions progress slowly, and weight loss may be one of the first signs that they are worsening. Even mental health issues, like depression, can play a role. Seniors who feel isolated, lonely, or disconnected might find it difficult to eat, further accelerating the weight loss and putting them at risk of malnutrition. If you notice significant weight loss in your loved one, don't ignore it. While it's tempting to try and fix the problem by encouraging them to eat more or offering favorite comfort foods, sometimes the issue is more complicated than just diet. Forcing large meals might not be helpful and could cause distress. Instead, focus on providing easy-to-eat foods that are gentle on the stomach and ensure they stay hydrated. Simple meals that provide comfort, like smoothies or light soups, can make a big difference without overwhelming them. But the key point here is, weight loss is a warning sign that shouldn't be ignored. It's a clue that the body is preparing for a significant transition. By recognizing it early, you can adjust your approach, providing the care, support, and comfort that your loved one truly needs during this time. It's about quality of life, ensuring that the time you have left is filled with dignity, love, and peace. If you've noticed unintentional weight loss in your loved one, especially if they're eating less, feeling weaker, or having trouble staying active, take this as a signal to pay closer attention. Understanding this change can help you navigate this difficult journey with clarity, compassion, and a sense of preparedness. 2. Extreme fatigue and weakness, understanding the exhaustion you can't ignore. As we grow older, feeling tired from time to time is natural. After all, we've lived a long life, and it's only normal to experience a bit more fatigue than we did when we were younger. However, if the fatigue doesn't seem to go away, even after a good night's rest, it may be more than just the usual tiredness. One of the most noticeable signs that the body is preparing for the final phase of life is extreme and persistent exhaustion that doesn't improve with sleep or rest. This type of fatigue is different from the occasional tiredness we all feel after a busy day or a long week. It's a deep, overwhelming sense of tiredness that makes even the simplest tasks seem exhausting. Getting out of bed may feel like an impossible challenge. Walking across the room could require more energy than expected, and everyday activities like cooking, dressing, or even holding a conversation may leave you feeling drained. It's not laziness, and it's not something that can be fixed by pushing through or getting more sleep. It's a sign that the body is slowing down and conserving its energy for vital functions. What's happening inside the body is a complex process. As we age, our organs begin to work less efficiently. The heart may not pump as strongly, and circulation can weaken, meaning that muscles don't get the oxygen and nutrients they need to function at their best. The body's metabolism also slows down, meaning it's using less energy for movement and more for maintaining essential systems, like breathing and heartbeat. This shift in how the body uses energy results in noticeable exhaustion. Another factor contributing to this fatigue is the emotional impact it can have. Many seniors who once enjoyed activities, socializing, or spending time with family may begin to withdraw from these things simply because they don't have the energy to keep up. It's heartbreaking for families to watch a loved one go from being active and engaged to feeling tired and withdrawn. They may stop participating in conversations, avoid social gatherings, or lose interest in hobbies they once loved. This emotional withdrawal is not due to a lack of caring or interest, it's a direct result of the fatigue they are experiencing. If you've noticed that your loved one is spending more time resting, struggling to keep up with everyday tasks, or avoiding activities they once enjoyed, it's essential to understand that this fatigue isn't a sign of laziness or unwillingness. It's a sign that their body is going through a major transition. Forcing them to do more or pushing them to stay active when they're exhausted could make things worse. Instead, focus on allowing them to rest when needed, offering comfort, and providing a peaceful environment where they can relax without feeling pressured. It's also crucial to support them emotionally during this time. This period of extreme fatigue can be frustrating and even isolating for many seniors. They may feel a sense of loss as they can no longer do the things they used to do. It's vital to remind them that it's okay to rest, and their worth is not defined by their ability to be active. By providing a calm and supportive presence, you can help them feel safe, valued, and loved, which is more important than anything else. If you notice that your loved one is constantly fatigued, not able to stay awake for long periods, or seems to get tired even from minor exertion, it's time to acknowledge this change in their body. Recognizing it early gives you the chance to adjust your approach and ensure that their remaining days are filled with the care, comfort, and understanding they deserve. This is not a time to worry about productivity or activity levels, but rather about making their life as peaceful and enjoyable as possible. By recognizing the signs of extreme fatigue and providing the support they need, you can help make these precious final moments meaningful and full of love. 3. Cognitive confusion and emotional withdrawal, signs you shouldn't ignore. As we age, changes in our memory and thinking abilities are common. It's not unusual to forget a name or misplace something every now and then. But if you've noticed that your loved one is becoming more forgetful, confused, or disoriented, it may be a sign that their body is going through more than just the natural effects of aging. These subtle cognitive changes can appear months, or even a year, before someone reaches the final stage of life, and it's crucial to pay attention to these signs. Cognitive confusion can manifest in different ways. Perhaps your loved one is forgetting familiar faces, repeating themselves, or getting lost in places they've known for years. They might struggle to follow conversations, or have difficulty remembering the simplest things, like where they put their keys or what day it is. These aren't just typical lapses in memory. They're often an indication that the brain is not receiving the oxygen and nutrients it needs to function properly, as circulation weakens and organ function declines. What you might also notice is that your loved one's mood and emotional responses start to change. They may seem less engaged in conversations, withdrawing from social interactions or hobbies they once loved. It's not that they don't care, it's that the brain, as it begins to slow down, processes emotions differently. They may become more irritable, anxious, or even detached, seeming to lose interest in things that used to matter deeply to them. This emotional withdrawal is a direct result of cognitive changes and physical decline, and it's something many families struggle to understand. For those watching a loved one go through this, it can be heart-wrenching. The person who once shared stories, laughed with you, or offered advice might now seem distant or unreachable. You may feel like you're losing them before they're actually gone. It's a difficult realization, but it's important to remember that these changes are not their fault. Their brain is simply adjusting to a body that is slowing down. So, what can you do when you notice these signs? The first step is to be patient. When someone is confused or withdrawn, it's not the time to correct them or try to bring them back to the way they were. Instead, meet them where they are, speak gently, offer reassurance, and create a safe, familiar environment for them. Sometimes, just sitting in silence together or holding their hand can provide comfort. It's important to let them know that even if they can't respond as they used to, they're still loved and valued. Emotional withdrawal doesn't always mean they don't want to interact. Sometimes, they may be too tired or overwhelmed by the world around them to engage. Rather than pushing them to communicate, allow them to set the pace. It's about creating an environment where they feel safe and supported, without pressure. Sometimes, simply offering a quiet presence can be more comforting than any conversation. It's also important to monitor their well-being in other ways. If cognitive confusion and emotional withdrawal are accompanied by other signs like weight loss or fatigue, this can further indicate that the body is preparing for its final transition. These changes don't happen overnight, and understanding the bigger picture can help you respond with compassion and clarity. By recognizing cognitive confusion and emotional withdrawal early, you're giving yourself the chance to adjust how you interact with your loved one. You can stop focusing on what they can't do and instead focus on what they can do, finding joy in small moments, offering gentle comfort, and continuing to provide them with the emotional support they need. These changes can be difficult to accept, but it's crucial to remember that love and connection can still thrive in these moments. Even if their words fade, your presence will still mean the world to them. 4. Frequent infections and slow healing, a sign that needs your attention. As we age, our bodies don't bounce back the way they used to. What might have once been a minor cold or a small scrape can now take much longer to heal. In fact, frequent infections and slow recovery are common signs that the body's immune system is weakening. These changes may seem minor at first, but they're important signals that should never be ignored. One of the first things you might notice is that your loved one seems to catch every cold, flu, or infection that goes around. What used to be an occasional sniffle or a short-lived cough now becomes a persistent issue. Infections that once would have been easily fought off by a healthy immune system take much longer to clear up. Even small cuts or bruises seem to take forever to heal, leaving your loved one vulnerable to complications. The reason for this slower healing process lies in the way the body's immune system works. As we age, our body's ability to fight off infections diminishes. The immune system becomes less effective, and it's harder for the body to recover from even minor illnesses or injuries. This means that infections that might have once been treated with a round of antibiotics or a few days of rest now require more time and possibly even stronger medications. One of the most common and concerning infections that older adults experience is pneumonia. Seniors are also at a higher risk for urinary tract infections, UTIs, skin infections, and even oral infections. These conditions can start out looking mild, but can quickly worsen, especially if the body's defenses are compromised. What's even more worrying is that sometimes, infections in older adults don't show typical symptoms. Instead of developing a high fever or feeling unusually unwell, your loved one may simply seem more tired, confused, or less interested in eating. This can make it harder to detect an infection early, which is why it's important to stay vigilant and keep an eye out for changes in their behavior. Chronic wounds are another key sign of the body's weakening defenses. If you notice that small cuts, scratches, or bruises aren't healing properly or keep reopening, this could indicate poor circulation or other underlying issues. As blood flow decreases, the body struggles to send oxygen and nutrients to the skin and tissues, slowing down the healing process. Pressure sores, especially in individuals who are less mobile, become a serious concern, and if not managed properly, they can lead to dangerous infections. At this stage, you may be tempted to push for aggressive treatments, hoping that one more round of antibiotics or another hospital visit might do the trick. But sometimes, focusing on comfort, rather than curing the problem, is the best way forward. For example, ensuring that your loved one stays hydrated, offering easy-to-eat meals, and keeping their skin clean and moisturized can have a far more positive impact on their quality of life than trying to fix every little issue with medication. In some cases, infections may be so persistent that they don't respond well to standard treatments, and it may be time to shift the focus from fighting the illness to providing comfort. Comfort measures, such as using a humidifier to ease breathing, ensuring a peaceful environment, and providing emotional support, can make a world of difference during this time. It's about reducing stress on the body, allowing your loved one to rest and heal in peace. If you notice that your loved one is experiencing frequent infections, slow healing wounds, or unexplained tiredness, it's essential to address these concerns early. It's not about rushing to fix every symptom but understanding that these changes are part of the natural process of aging. By recognizing the importance of these signs, you can offer your loved one the care and comfort they need to navigate this challenging stage of life. Understanding and managing frequent infections and slow healing can greatly improve your loved one's quality of life during this time. You can make their remaining days as peaceful and comfortable as possible, knowing that you're providing the best care possible, even in the face of these challenges. 5. Changes in breathing and circulation. Understanding what's happening in the body. As we age, our bodies go through many changes, and some of these changes can be subtle but incredibly important. One of the most significant, yet often overlooked, signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. While it can be worrying to see someone you love experiencing these changes, understanding why this happens can help you offer the support and care they need during this time. You may start to notice that your loved one's breathing has become slower, more shallow, or even irregular. They may take more frequent pauses between breaths, or you might observe that their breathing speeds up and slows down unexpectedly. Some individuals experience a unique breathing pattern called Cheyne-Stokes respiration, where their breathing alternates between deep, rapid breaths and long pauses. While this can be alarming to witness, it's often a natural part of the body's process as it prepares for the final stage of life. These changes happen because the body is shifting its focus. As circulation weakens and the heart's ability to pump blood efficiently decreases, the body redirects its energy towards sustaining the most vital functions, such as breathing and maintaining organ function. As a result, less blood is flowing to the extremities, like the hands and feet, which can cause them to feel cold or appear pale and blue. This can be unsettling for families, but it's important to understand that this is the body's way of prioritizing life-sustaining processes. Another common sign that you may notice is an increase in shortness of breath, even with minimal exertion. For example, your loved one may become winded just by sitting up, talking, or even shifting their position. Activities that once felt effortless, like walking across the room or climbing stairs, may now feel exhausting and lead to breathing difficulties. Sometimes, fluid can build up in the lungs, making it even harder to breathe, and this can result in a persistent cough, gurgling sounds, or a feeling of tightness in the chest. These changes in breathing and circulation are part of the natural process, but they can still cause anxiety for both the person experiencing them and their loved ones. It's natural to want to help by encouraging deeper breaths or worrying about their comfort. However, it's important to remember that these are signs of the body winding down, and forcing changes may not be the answer. Instead, focus on creating a comfortable and peaceful environment for your loved one. If they seem short of breath, consider propping them up with pillows or encouraging them to sleep in a recliner to ease their breathing. Keep the room cool and consider using a humidifier to help with any congestion. These small adjustments can make a big difference in how your loved one feels. Offering sips of water or helping them stay hydrated can also ease discomfort. Sometimes, medications or oxygen therapy can provide additional relief, but the primary focus should be on comfort, not forcing their body to work harder. If you notice changes in your loved one's breathing or circulation, like slower, shallow breaths, cold extremities, or shortness of breath, it's important to stay calm and focus on offering comfort and emotional support. These changes are signs that the body is conserving energy, and while it's not always possible to reverse them, you can make the remaining time as comfortable and peaceful as possible. It's easy to feel helpless when you see your loved one struggling with these changes, but understanding that these are natural parts of aging can help you provide the right care. Focusing on comfort, being present, and offering a calming presence can bring both you and your loved one peace during this challenging time. The importance of recognizing early warning signs, why it matters. As we navigate the later years of life, we may notice subtle changes in ourselves or our loved ones. Some of these changes can be difficult to accept, but they're often signs that the body is preparing for a significant transition. Recognizing these early warning signs isn't just about preparing for the inevitable, it's about offering better care, making the most of the time left, and ensuring that our loved ones are as comfortable as possible during their final months or years. One of the greatest gifts we can give our loved ones as they approach the end of their life is the ability to prepare. While it's impossible to predict exactly when the end will come, understanding the signs that the body is winding down allows us to adjust our expectations, provide the care they need, and cherish the time we have left together. It gives us a chance to offer comfort, love, and peace, which is far more valuable than trying to fix or prevent inevitable changes. The signs we've discussed, such as significant weight loss, extreme fatigue, cognitive confusion, frequent infections, and changes in breathing are often the body's way of signaling that it's time to slow down. When we recognize these changes early, we can make important decisions about how to care for our loved ones. Instead of waiting for a sudden crisis to force us into action, we can be proactive, ensuring that we provide the best possible support during this sensitive time. By acknowledging these signs early, we also give ourselves the emotional space to process the reality of what's happening. It's easy to ignore or brush off these changes because they can be uncomfortable to face. But by recognizing them, we're taking control of the situation. We're preparing ourselves to be strong, patient, and compassionate. This allows us to show up for our loved ones in the way they need, offering them comfort, dignity, and peace, rather than being caught off guard and overwhelmed by the inevitable. Moreover, recognizing these signs allows us to cherish the moments we have left with those we love. Instead of focusing on what they can no longer do, we can focus on making the most of the time we have together. We can create lasting memories, share meaningful conversations, and offer emotional support during their final stages of life. These small, simple moments will stay with us long after they're gone, and they provide a sense of closure and peace. It's also essential to understand that recognizing these signs doesn't mean giving up or accepting defeat. It's about respecting the natural process of aging and embracing the changes that come with it. It's about knowing that, while we may not be able to stop the inevitable, we can control how we care for our loved ones in their final years. And in doing so, we ensure that their journey is filled with love, dignity, and respect. So, when you notice these early warning signs, don't be afraid to face them. Use this knowledge to adjust your approach and offer the best care possible. You'll not only provide comfort and support to your loved ones, but also find strength and peace within yourself. Recognizing these changes gives you the opportunity to make every remaining moment count, to say the things that need to be said, and to make the transition as peaceful as possible. Understanding these signs isn't about fearing the end, it's about preparing for it with clarity, compassion, and love. By doing so, you can provide your loved one with the most meaningful and fulfilling final chapter of their life. Conclusion. Key lessons for supporting your loved ones in their final stages. Recognizing the early signs of decline in elderly loved ones is essential for providing compassionate care. By paying attention to changes such as significant weight loss, extreme fatigue, cognitive confusion, frequent infections, and irregular breathing, you can better prepare to offer the emotional and practical support they need. Key takeaways. 1. Early awareness is essential. Identifying the early signs allows you to respond proactively and adjust care to ensure your loved one's comfort and well-being. 2. Focus on comfort and dignity. Instead of trying to fix every health issue, prioritize comfort and emotional support, ensuring they feel cared for and valued. 3. Cherish every moment. Use this time to create lasting memories, share stories, and express love. Making each moment count is crucial for both you and your loved one. 4. Emotional preparation is key. Recognizing these signs early gives you the emotional space to prepare for what's ahead, allowing you to approach this challenging time with clarity and compassion. By embracing these lessons, you can ensure that your loved one's final months are filled with peace, comfort, and love. Understanding these changes will help you provide the care they deserve and make the most of the precious time you have together.